This is The Beauty Buzz, an educational podcast for the health-conscious consumer.
Welcome. I'm Brandelyn Cameron, and we're joined by
Dr Violet Newman of Lakeview Dental Centre.
And so why don't you tell us what we're going to be talking about today?
So today we'll be talking about the oral health connection.
Okay.
That's a major area of interest for me, and I'll tell you why. Our oral health influences a lot our general health.
Okay.
So we are in the business to give people healthy, beautiful smiles, but in that process, we need to stay healthy. And if our oral cavity is not healthy, the whole body suffers.
Okay.
Latest studies show that oral health is responsible for, poor oral health, I should say, is responsible for more than 50% of heart attacks, strokes, Alzheimer's disease, different inflammatory conditions in the body like rheumatoid arthritis, lung problems, diabetes, high blood pressure.
Is all starting in the mouth.
Exactly. Different forms of cancer like pancreatic cancer is
Wow.
directly caused by oral pathogens.
Okay.
Alzheimer's disease.
Okay. So how are you investigating and treating? Like, where has dentistry evolved to such a point that you can go through this and be able to identify this?
Well, historically, we only did dental cleanings, right? We go under the gum and remove those pathogens. Now, we have over 200 pathogens in our mouth, and not all of them are bad. And the whole concept was that reducing the number of those pathogens in the mouth would keep the gum disease under control and the cavities under control. So that's where professional cleaning comes in. Now we know that about 7 of them are very aggressive pathogens.
Okay.
And those are the ones responsible for heart attack, strokes, Alzheimer, cancer,
Okay.
and so on and so forth. So we have now the possibility to test those pathogens through a simple oral swab.
Okay.
And we use the Oral Vital system.
Okay.
An easy swab, just like when you get your swab done for your sore throat, right? We take a swab from everywhere from the mouth and around the gums of the infected teeth. We send back to the lab, and we can identify exactly, precisely what kind of pathogens are causing the gum disease.
Okay.
And then once we identify those, we get treatment recommendations in terms of antibiotics that would work against those.
Okay.
Now, everybody is afraid of using antibiotics because we know they affect our microbiota in our gut health. So we use those antibiotics for gum disease. We use them in a mouthwash form.
Okay.
And in that form, those antibiotics concentrate about 5,000 times more than if we take them orally.
Okay.
And they don't have the general side effects.
Okay.
And the treatment outcomes for those are amazing. We get amazing improvement in oral health, and we can prevent those major health issues.
Okay. So if somebody how would they know if they have gum disease, for instance?
That's a good question. Many people are concerned about bad breath.
Right.
Bad breath is a sign of gum disease.
Okay.
Those aggressive pathogens I was telling you about, they produce volatile gases,
Okay.
and they cause bad breath.
Mm-hmm.
So if somebody has a bad breath, that's an alarming sign, and it means we need to do some testing.
Okay.
Also, bleeding gums are
Yes.
a sign of gum disease,
Okay.
right? The gums are not supposed to bleed, no matter how diligent we are with brushing, flossing, how hard we push on the brush.
Mm-hmm.
The gums are not supposed to bleed, just like the skin, right? You don't expect your skin to bleed when you scrub your skin.
Right.
And we should not expect the gums to bleed at all. There's zero tolerance for bleeding in the gums. Those bleeding gums are like open wounds
Mm-hmm.
when all those pathogens leak into the whole body, causing chronic inflammation. Our immune system has to fight really, really hard to keep those under control. So
Okay. And so that being said, what about when gums start to recede? What does that mean?
well, that's a different story. They could be receding after the gum disease. Once we have
Okay.
gum disease, the gum disease gets treated. Those inflamed gums, they shrink back to normal, and you can get recession. But also gums can recede from other causes like grinding and clenching.
Okay.
And usually the main concern of patients is not only aesthetic, but also sensitivity to cold, sensitivity to brushing.
Okay. So now if a patient is coming to be treated for gum disease, how long is that process? Does it vary?
if the patient, we do an exam first when a patient comes in,
Okay.
and we assess the gum status and the breath. If there are concerns, we do recommend your vital testing, and we typically do that before the cleaning,
Okay.
or 4 to 6 weeks after the cleaning was completed. We send those results, we send those swabs to the lab, and typically we get the results within a week or two,
Okay.
along with the recommendations for the antibiotic mouthwashes that would be suitable for the case.
Okay.
And typical treatment lasts for 2 weeks.
2 weeks.
Using those antibiotic rinses, follow 1 week of antibiotic rinses usually, followed by 1 week of antimicrobial rinses, and then a reevaluation of the gums
Okay.
in terms of the bleeding pockets. And
Okay.
that.
And so then once they've completed the 2 weeks and you do your reevaluation, would they ever repeat the course of treatment, or what would happen next?
Yes, that's a good question. Sometimes we do repeat the treatment. Sometimes people notice that bad breath comes back.
Okay.
And we need to keep in mind gum disease, cavities are infectious diseases.
Okay.
We transmit those pathogens from one to the other.
Oh wow. Okay.
So if one person in the family is treated for gum disease, chances are that the rest of the members in the family do harbor the same kind of pathogens.
Okay.
So we do recommend that everybody that we're in contact with gets the treatment for those pathogens.
Excellent. That's incredible. That's like, there's so much information that we covered today. I want to thank you so much for being here with us and explaining the total body health connection and starting in your mouth and moving on from there. It was really interesting. Thank you.
Thank you for having me.